think that that's everything mentioned. Yeah, please keep yourself muted, and it'd be great to see your cameras so we can see your faces. So that Charles has is seeing that you're speaking to humans and not robots. So great. We'll pass over to Charles to begin his presentation tonight.
Okay, thank you very much, Bilal, and thanks everyone for attending. So let me just share my screen. Can you all see that? Can you all see that?
Yeah.
Okay, so like as Bilal said, today's meeting is on comparing Cuba and Britain's responses to COVID, looking and in general comparing socialism, the socialist response with the capitalist response. So I'm going to start off talking about the cost of COVID, the devastation that it has wrought. Then a brief on the origins of COVID and the lessons we can learn from that. Then looking at the capitalist response, followed by the Cuba's response, and then a little bit at the end on vaccines. So depending how we're doing for time, I might have to whiz through some of the slides. I can't actually see anybody. It's probably because it's full screen. Anyway, can you all see me?
Yeah.
Okay. So the main summary, which everyone should take away, the points that we're trying to make today are the capitalist countries, such as Britain's recorded over 65,000 deaths, about 80,000 excess deaths when compared to 5-year average, last 5 years. The US over 300,000 deaths. The US has only 4% of the global population, but 20% of both cases, recorded cases and recorded deaths. Europe in a similar situation, 10% of the global population, but it has 28% of recorded cases and deaths. Cuba, in contrast, has had only 137 recorded deaths. It has one of the lowest infection rates in the world. And even the worst affected countries like Italy have actually requested Cuba's assistance, Italy being short of many specialists. In addition, in general, the richest countries, the capitalist countries, have the highest levels of infection and death, and they are incapable of looking after the health needs of the working class and vulnerable, constantly pushing on scientific policies at the expense of the working class. And their main aim is basically to safeguard a capitalist system. Cuba, on the other hand, has been putting the health and well-being of its population first. It has a world-renowned healthcare and immunization program. It has sent 53 medical brigades to over 40 countries, specifically to fight COVID-19. And it is developing 4 vaccines specifically for the coronavirus. So just looking at the cost, so about 1.6 million people have been killed. At least almost 80 million people have been infected. According to the World Health Organization, you can multiply that by 10. And then the monetary costs, actually, is there a is there a spotter here? Yeah, pointer. Want a pen, or do we want to just give us a second? Highlighter, no. Laser pointer, that's it. So you just want to concentrate on this figure. So this is the amount of money that the central banks have pumped into the system so far. The UK at least $250 billion, and in total is over $10 trillion have been pumped in. And the amount of money, certainly for the US, that has been pumped in is double the level that was pumped in 2008. And the fiscal deficit for 2020 has not been seen since the Second World War. So that shows how serious the situation is. But even that doesn't capture all the money that's been pumped in. So for the US, there's over $6 trillion here, and then there's all the other like asset purchase commitments, direct lending, the backstop programs, guarantees, and the cumulative total just for the US is $8 trillion. So in total, it's talking over 14 trillion has been pumped in by the US just to save the system. For the UK, the Chancellor's already announced that Britain will spend 280 billion. The public sector debt is over 2 trillion. And the borrowing for this year will be almost 400 billion pounds. Again, approaching levels reached during World War II. Most of this money, this 280 billion, is basically going on economic support, including the furlough, as well as more wasteful spending, as we all know. This is a comparative table, just making the same point. This is how much was spent during the last crisis. Britain was planning to spend about 55 billion this year, and so far, like we said here, it's about almost 400 billion. So this BBC graph is you have to add it's almost double that. It's almost up here, 400 billion, and you can see how it dwarfs the spending of the last few years, last few decades. The global debt. So globally, debt has now reached 365% of GDP. So a lot of money. And then if you look at the money supply, the amount of money being pumped into the system compared with the last crisis, it's double, and it's growing at a faster rate compared to the 2008-9 financial crisis. So trillions have been pumped in basically to prevent the collapse of the capitalist system, and the working class will be expected to pay all this money back through austerity, wars, and attacks. Looking at a comparative table for the deaths. So rather than just looking at the number of people who've died, this is a good way to compare it. The number of cases per head, the amount of people who've died as a proportion of the infections, and the amount of people who've died as a percentage of the population. China, there's a lot of people who are saying China's fiddling its figures, maybe, but you can see that its figures is in line with the rest of Asia. So I would say those figures are quite accurate. Cuba and Venezuela, you've seen they've done very well, better than Japan, and they're on the blockade, those two. And then the UK is among the worst affected countries. I mean, look at the difference in terms of cases, and okay, the mortality is probably similar to some of these, but look at the deaths per head of population. And I've added Sweden in there. You know, people have been saying, you know, maybe we should try herd immunity and all that. Sweden is up there with. Sweden and New Zealand. and they accounted for almost 206,000 excess deaths. England and Wales alone accounted for 28%. And then when you add Scotland, basically the UK is the worst, more than a third of all the excess deaths in 21 industrialized countries. And in this study, the countries that had the highest excess deaths had the lower rates of public investment in healthcare, and those that had the lower death tolls had comprehensive testing and contact tracing or early lockdowns. This is just comparison, so you can see how badly Europe's doing up there, using this time its case fatality rates compared to China and other countries. Like we said before, Europe, 10% of the world's population, a quarter of the deaths. Even its well-equipped hospitals feeling the strain. And in the UK, compared to the other Anglo-Saxon nations, it's just doing worse by any measure, whichever measure you look at. And then this is just comparing the differences in different countries. So red is the deaths per head per million. This only goes up to October, but with the US obviously shooting up. You can see that the infections follows the same pattern as the deaths. That's blue, the infections, and the hospitalizations also follow the same pattern. So the more people get infected, the more end up in hospital, the more die. So even if the infection numbers are not accurate, you can't hide the hospitalizations and you can't hide the deaths, and they are going up. And it's just look at the difference between the US, China, Venezuela. The UK off the chart, Italy off the chart. Again, same pattern. And then there's this false argument about, well, we need to open up the economy because that, getting people back to work and that's going to help save lives. This graph shows up here this is zero effect on GDP. And then, so these are all the falls in GDP. So the lower you are, the worse your economy is done. And then on this side, the deaths. So the further you are up over here, the more deaths. And so China, Vietnam, they've done very well, very few deaths, and in fact, Vietnam's grown. This is from October, by the way. And there's Cuba, hit to its economy about 11%, 10% of GDP fall because of the tourism industry having to be shut down, but very few deaths because it prioritized human life. Whereas the UK in October, it was there. I think the GDP fall is about 11%, but it's one of the worst affected countries, along with Italy. I think Belgium is over here as well. The Sweden's on this side as well. Chile, Brazil, all the capitalist imperialist countries are on this side with the worst deaths. Just going to scoot through these ones about the origins. So yeah, it first detected, that's the main thing, in China, but the origin, where a virus breaks out and where the origins are two different things. First patient presented on the 1st December in Wuhan, but they found antibodies in the US from the 13th of December, antibodies in Italy in September of last year, and even the virus detected in sewage in Spain in March. So what that means is that the epidemic was not detected in time, and basically China done the world a favor in actually detecting the virus, but we still don't know where the origins were. There's been talk about the different strains. I'm not gonna labor on this. There are 7 strains at the moment. The more you allow the virus to spread, the more it will mutate. So the L strain was from Wuhan, and that's disappeared now in Asia. It's mainly all blue. But the blue strain is now spreading all over the world. and is now the dominant strain in November, whereas the old Wuhan strains disappeared. The best way to avoid these changes is to stop the virus spreading, which the Europeans didn't do. Yeah, so previous pandemics, basically, so the H3N2 virus came basically from factory farming. The outbreak was in Mexico, but the origin was in the US. And it was caused by factory farming, long distance animal transport, intensive animal farming. This is just about North Carolina, had the biggest, the most mega farms in the US, were $2 billion. A lot of traveling coast to coast to save costs. And then, you know, the virus has more chance to mutate and spread on these larger mega farms. So you can see the big jump from 92 to 98, 2 million pigs to 10 million pigs, 15,000 farms to 3,600 farms. So the number of farms was smaller, but more pigs on smaller farms, which means you get more chance of spread. And it's just saying the same thing. 99% of the farms had more than 1,000 sows, and actually the majority had over 5,000 sows. And that's where these viruses come from. There are over 1.5 million viruses. Only 250 are known, and it's caused by, you know, contact between humans and animals, which from deforestation, encroachment, urbanization, and intensive animal farming, which is all driven by capitalism. So how do you control these outbreaks? You have to do active case finding, yeah? Find the people who are infected, isolate them, and then find their contacts, who have they come into contact with, and then have social distancing with economic support. And you need to find at least 80% of those who are infected, so that's here, and 80% of their contacts. Sorry, that's here. And depending on what the reproductive number is, to control the outbreak, you need to get at least 80% of contacts traced and isolated. Yeah, obviously, if the reproduction number is higher, like the red line where it's 3.5, if it's higher, then tracing 80% won't be enough. That will only give you 40% of the outbreak. So if the R number gets higher, you need to basically trace everybody. But the lower the R number, you know, to get more control, you contact fewer people, but essentially 80%. And the imperialists have been unwilling to do that and unable in the case of the EU. Even South Korea cases are increasing now because they've lowered the social distancing. So what has Cuba done? It's done the active case finding, targeted PCR testing, not telling people to seek a test if you want one. You know, they make sure you're tested. All infected people taken to isolation centers. There's no self-isolation. All schools were closed. TV channels set up for children on TV. And they've only had less than 9,500 cases and 137 deaths. They test both those with symptoms and without symptoms. They introduced antiviral medication early on. They even treat people without symptoms, yeah, with these medicines. Those who have comorbidities are given interferon gamma. Those without given interferon alpha 2b. And they have 7 institutions dedicated to COVID research, and they closed their borders, making masks mandatory and suspended public transport. So at this stage, we'll just watch a few videos just showing what Cuba has been doing. Can you still see?
Yeah.
Okay.
Hi, Charles. We can't see it quite yet.
You can't see?
No, we're still on the PowerPoint. Maybe you have to stop the share and then put it back onto the video, or share the YouTube, or whatever you're using to play it. Yes, there we go. Good job.
Sorry,
if you want to
again, it's not a long video.
Yeah, you want to play it? Yeah, there you go. Yes.
Enfermedad que está azotando todos los países en el mundo. Nuestro país no es la excepción. El médico de familia en estos momentos juega un papel fundamental. Vive en la comunidad. No esperamos que acudan al médico de familia, sino que vamos activamente a sus casas. Buenos días. Somos del policlínico. A veces hay alguna persona con fiebre, con catarro, con síntomas respiratorios. Todos estos estudiantes están incorporados a las acciones de pesquisa, tratando de llegar a todos los cubanos en el menor tiempo posible para evitar la transmisión de esta enfermedad.
Los mismos médicos que nos dan clases dicen que es una cosa que antes nunca se había visto. Obviamente estoy preocupada, pero bueno, yo elegí ser médico y es lo que me toca.
¿Tienen más miedo o más optimismo?
Optimismo siempre. ¿Qué clase de médicos seríamos si no tuviéramos pesimismo?
Buenos días, soy el médico sanitario. Nos sentimos preocupados, no hemos llegado aún al pico máximo de los casos. Estamos trabajando para modificar el curso de la enfermedad, identificando al enfermo y aislándolo y tomando las medidas de prevención con la población sana.
¿Tienes confianza en el sistema de salud de Cuba para poder enfrentar?
Plenamente.
¿Por qué confías tanto?
Porque son unos mejores médicos del mundo.
Buenos días, ¿qué edad tienes?
71. Yo soy persona de riesgo, ¿no? Porque yo soy asmática, hipertensa. Siempre, los médicos siempre están chequeando, más ahora, y le agradezco muchísimo a ustedes.
Nos hace sentir muy orgullosos porque nuestra población sientan que las cosas que hacemos pues les son de beneficio. Realmente esa es nuestra razón de ser.
Okay, sorry about that. Some technical problems there. There's another one. It's very short.
And I was studying in the United States, and because of the coronavirus crisis, I decided to come back to Cuba. I was taken to these students' dorms south of Havana with more than 200 other people. We are coming from United States, Dominican Republic, Turkey, Canada, Spain, Italy.
Vengo de Italia y veía cómo moría las personas, 700, 500, 600 diarios. Decidía quién vivía, quién moría.
Sinceramente yo me siento más segura aquí en mi país.
Everybody has felt pretty confident in the health system because with all the limited resources we have, Cuban doctors have more experience working in hard situations.
Mira, cariño.
Gracias. The doctors and nurses are really nice. They change your mask, they check your temperature 3 times a day. There is not much to do here. Mostly people spend time on their phone. They read, they talk about the crisis, they follow the news. Some walking around just to keep moving. You have funny things like the guy who knows his family is waiting for him to put him in charge of all the shopping. So he says, I'm fine here. I don't have any worry here whatsoever. So I'm good. I'm not in a rush to leave. It's something very surprising how close people have become in only 2 weeks. I've been in a room with other 3 women, and we consider ourselves friends now.
Me siento bien porque ayudaron a mis cubanos. No me pongo a llorar porque voy a aguantar. Lo estoy haciendo por ustedes. ¿Ok? Los quiero. Estoy hablando con el corazón.
3 days ago, we did the test. Everyone was negative. Still, we were instructed to finish the quarantine. Every night at 9 p.m., like in the rest of the island, everyone in the center claps to give thanks to the doctors. The biggest applause was the day before we finally went home.
Okay.
My name is Monica.
Okay, let's push on. Can you see this?
Not quite, no, not yet. We've just got your video so far.
Share.
There we go.
Yes, can see.
Okay. People are isolated, but with support, not just go and self-isolate and that's it. You saw the doctors there actively looking for cases. Do you have a cough? Do you have a fever? Da, da, da. In addition to that is economic support for low-income families. People in hospital have 50% of their salary guaranteed, taxes, debts suspended. And basically by July, Cuba had it under control. Can we get rid of this? There were nationwide workshops to produce masks. Health and non-health workers were trained before the virus arrived. And this is important. All Cubans already, before the pandemic, categorized into 4 groups: apparently healthy, risk factors, those who are ill, and those who are in recovery or rehabilitation. So they know automatically, the doctors are alerted to those who are susceptible, who have risk factors and who have complications. So they're already on you, to prevent people getting sick. Why is this not moving? So from the imperialists, no solidarity. These were the headlines that we were getting in February. Chinese Chernobyl. From Cuba, international solidarity. 53 Henry Reeve Brigade sent over 40 countries, including Italy, Togo, Venezuela, Azerbaijan. And this is in addition to brigades who are already in 59 countries. Actually, this is important. How are we doing for time, Chair?
It's 20 minutes to 8 at the moment, so I think we're okay for time.
Okay, we don't want to take too much time. I'm going to play just a few minutes of this just to make the point.
It's easy to use.
The need to human resource cannot be gainsaid. I'm also glad, therefore, to announce that the government of Kenya is today receiving some from the Henry Reeve Brigade, who will be arriving in the country tonight to serve and offer services for the next 6 months. The idea here is for these doctors to work with our own doctors to gain knowledge from each other. As you know, we have been working since 2018. We have worked and partnered to improve healthcare services with the Cuban government. And this partnership has seen Kenyan doctors receive specialized training in Cuba, and Cuban doctors provide health care services throughout our country. But this particular one is a special brigade that is going to be stationed at KU. It is not going to be split around the country. And they are specialized doctors in internal medicine, oncology, cardiology, renal, and pediatrics. With the COVID-19 cases rising, these specialized doctors will go a long way in supporting our doctors in managing the disease, and also in exchanging of skill development. On behalf of the government, we are thankful to the Cuban government through Ambassador Ernesto Gomez Diaz for this kind gesture. We also want to thank His Excellency the President, through which effort we are receiving these doctors. It took a telephone call, a discussion between our president and the Cuban president for this brigade to be made available to us. And we are really grateful for that gesture from the Cuban government. We are also grateful to KU.
Okay. That's just a little snapshot there. Hang on. Okay, so that was showing that the Cubans were supporting the Kenyans. There's other videos we could show, but because of time, we'll leave that. And they're also training doctors and nurses from those countries, both in Cuba at the Elam Medical School, but also training them in the countries where they visit. So you heard the official there saying how the Cuban doctors were training their Kenyan counterparts in Kenya because they don't want to create that dependency. So that's showing the real solidarity. In the capitalist countries, no basic public health measures, no active case finding, inadequate or insufficient testing. The onus is on you to get tested. Asymptomatics are not tested. Even the symptoms profile is very narrow. The loss of smell and taste was only introduced after 34,000 deaths. The lockdown was too late. The lockdown lifted early. Even social distancing rules were relaxed. And there was no travel restrictions. People were coming in from Italy. They closed the border to China, but people were coming in from Italy. And that's where most of the infection came. Same with the US, never had a lockdown, no centralized test and trace, no centralized isolation. You know, you saw in Cuba, they said you are forced to go to the isolation center. It's not just up to you. And then they have all these unscientific rules, curfews around 10, groups of 6, groups of 50, groups of 30, and, you know, and so on. No science behind it. No support for workers. In Britain, they introduced £130 for a 10-day isolation period. But even that, to qualify for that, you had to jump through all these hoops, you know, universal credits, you had to live in Oldham, you had to, you know, this, that, and the other. You had to be unable to work from home. Then in September, it was increased to £500, but parents who stay at home are excluded. If you don't have the app, or if you were told to, if you have the app, you don't qualify. You know, you still have bills to pay. You know, these parents still have bills to pay, food to get. And then in Liverpool, during the mass testing, 80% of those who applied for this £500 were rejected. Now, this slide shows the importance of isolating infected people. So in the last week of November, December, it's estimated that there was about 180,000 people infected, right? about 60% of them have symptoms, right? So these others are not being tested at all. Of those who have symptoms, they tested about 94,000 they tested 1.5 million, but 94,000 tested positive, okay? So out of these people who have symptoms. Not all of them are transferred to test and trace system. About 91,000 were transferred. Only I think 89% of them were actually reached. Only I think 60% of these people provided a contact. And then only 89% of them, those contacts were asked to isolate over the phone. And the figures show that only 20% of these people are actually isolating. So these are the only people who said that they were isolating. We don't even know if that's true. But then there's all these people, almost 170,000, both those who have symptoms and not symptoms, those who they didn't reach, those who didn't provide a contact, just not being tracked and traced. So what is the point then of the whole? Like I said in the article, if you can do all the testing in the world, but if there's no isolation, there's no point. So like I said, people are told to self-isolate over the phone. They reduced 14 days isolation to 10. There's no support for multi-generational households in overcrowded accommodation. Scientists have asked for that money to increase to 800. And of course, like I said, without financial support, the testing and the contact tracing is irrelevant. It's all about profit. Test and trace have been privatized. Out of the 35 organizations involved, only 8 are NHS bodies or public health bodies. The rest are private companies. Massive budget, 22 billion. Same with the moonshot testing, the PPE. There's little transparency or documentation. Basically, the government sees it as an opportunity to embed the private sector. The test and trace system is not working. Only 38% return in 24 hours. It was even lower during the second wave. Only 85% reached. Only 60% of close contacts reached. The contact tracers, like in the call center, are only spending 1% of their time actually working. And the head of the service is actually reporting directly to the Prime Minister, bypassing the health ministry. You can't imagine this happening in Cuba. That's telling me half an hour is up. I'm going to speed through now. So a lot of these capitalist countries are pursuing the regional approach, which doesn't work. So in the US, the current hotspots are right next to the previous hotspots. So basically the hotspots are just shifting. So you get it in control in one state, and then because people are traveling between states, it just shifts to the next state. This is France. They introduced regional controls on the 23rd, curfews, gatherings of 1,000 instead of 5,000, but cases still going up. Then they introduced the lockdown, and then it started coming down. But they resisted that lockdown for economic reasons. Netherlands, the same, regional approach in 6 regions. 50 people could gather, curfew at 1, then they increased to 8 more regions, 14 regions, still going up. And then partial lockdown, still going up. And then finally they did then they started coming down, then they lifted the partial lockdown after a month, and then it started going back up again, and now they've gone into total lockdown. And they resisted the lockdown for economic reasons. This is Britain. They never allowed the infections to reach 0 in July. Then they loosened the regional restrictions and started introducing regional lockdowns in Leicester first. Then they introduced the tier system, still going up after the tiers, and then the second lockdown. And then they've lifted it. It started coming down, but they've lifted it way too early, 2nd of December, and you can see it's already going back up again. There's no protection for workers. Shortage of PPE, no PPE for essential workers. Look at the number of teachers that have died. It's very hard to get these figures because they're not publishing the figures properly. Healthcare workers, 300, social care workers, 300 in the US. Yeah, you have to multiply those infected probably by, what's the number in the US? 1.6 million. So yeah, it's possibly 53 million. Same thing, workers forced to work without PPE. 1,700 health workers have died. 200 nurses, 60% people of color, nearly 300 teachers. And then the infection rate just reflects the racism, structural racism in US society, mainly Latinos, or higher rates of Latinos and Blacks. Same thing in Britain, more workers are exposed to infection than others, those in the caring occupations. So this would be like the normal rates among people, among men, obviously, in the general population. So these are all above the normal rates, and these are below, you know, managers, professionals, these are below, these are above, especially caring, process plant operatives and elementary occupations. That's for men. Not as bad in women, but same thing in women: caring, process plant, elementary. And this is in the first wave, March to May. Again, who are the people who work in these occupations? So this is the general population for men. These whites, black. These are blacks, these are other, these are Bangladeshi, these are Indian. And you can see in some professions like taxi drivers, the Bangladeshi and Pakistanis are overrepresented. And if you go to the previous slide, that was the I think that's service, isn't it? That's one of the worst affected. Cleaners on domestic, overrepresented by the blacks, security guards, nursing auxiliaries, blacks, care workers, blacks, and so on. So people in those professions are more exposed to the virus. This is from the BMJ, doctors who've died from COVID, and the vast majority are from a BAME background. And these are just a snapshot. In Cuba, so they have more beds, 5.3 beds per 1,000 than the UK or the US. And that's why that helps. That's why these countries have done better, you know, Japan, South Korea, Cuba, than, you know, India or the US, Italy, and so on. And then Cuba has the most doctors per head, 9. It's off the chart, it's up here. The UK among the worst number of doctors. The US is there. Okay, this is from 2018. So, and then what results has Cuba achieved? In spite of the blockade, no health worker has died. Yeah, over 300 in Britain. No health worker has died. No child has died. Now, this is important. In Cuba, children and elderly are given special attention and special protection. So if you read some of the media, they try to explain why the death rates in Africa have been lower than in Europe. And one of the explanations they come out with is that the average age in Africa is younger, it's 18. Whereas in Europe, it's 42. Yeah, it's older, and in the US, it's older. It's 30, and that's why there's more deaths in Europe. Well, that's true. Younger people do survive being infected, but you have to protect those people who are vulnerable. So in Cuba, they protect the elderly. Yeah, 65% of their deaths were people between 20 and 59 up to May. In Belgium, one of the worst affected countries, it's the other way around. 55% of deaths were over the age of 75. And in England, it's the same, it's worse. 90% of deaths were people over the age of 65, yeah? So these are the deaths for England. It's mainly elderly people. And this is the hospital admissions, again, mainly elderly people. The infections is mainly young people getting infected, but there's no reason why these people have to die if you protect them. Cuba has done that, yeah? No transmission in any school, yeah? And this is another thing. Globally, 80% of the victims who are in serious or critical condition die. But in Cuba, it's the other way around. 80% of people in serious or critical conditions survive because they put public health first. Now, quickly on the vaccines, again, another source of profit for the capitalists. Totally developed for profit. Political pressure put on scientists to rush the vaccines out quickly for political gain, you know, Donald Trump's election and so on. There's a headline from one of the British papers that wanted to put the Union Jack on the Oxford vaccine. The revenue, look at the revenue that just 5 companies are going to get next year, billions. And most of the vaccines that have been made or scheduled to be made next year, the imperialists, Japan, Canada, US, EU, and Britain have basically bought up 51% with options for an extra 5 billion. The rest of the world will only have a fraction of that, less than 1 billion doses. And each person needs 2 doses. And this is the projected sales for coming years. So it's going to go down, but we're still talking billions. And that's the motivation, not to save lives. Cuba vaccine is developed for the benefit of all Cubans. They will be fully tested before they're brought out while implementing the test and trace. And the vaccines will be made available for the world via the World Health Organization. So 2 Cuban vaccines have been included on the WHO's list. So this is what we should be demanding on the streets in Britain, and the privatization of test and trace. It should be run by the NHS, should be brought in-house. It should support and pay all workers at least 800 to self-isolate. They should give WHO recommended PPE for all key workers, and they should bring all these contracts, PPE contracts, back in-house. They should put public health before capitalist profits. Thank you. That's it.
Excellent. Thank you very much, Charles. Your presentation was, it was great. It was full of data, full of information for us to pore over multiple times, I think, before we've got it all in our heads. Yeah, thank you so much for your presentation. So we'll be going on to questions in a little